Let's talk about the vestibulococclear nerve, which is the eighth cranial nerve. This nerve is again pure sensory nerve, and let's start with its nuclei. It has got two sets of nuclei. So concentrate on the area, the cut section of the pons and upper medulla in which its nuclei are buried. You can see that the vestibular nuclei are there. They are four in number. These are the lateral, medial, superior and inferior. Rather, you call them as vestibular nuclear complex. And then you can see that there are two cochlear nuclei, the ventral cochlear nucleus and the dorsal cochlear nucleus. And of course, on the posterior aspect of this medulla and pons, the cerebellum lies in connection with that of the inferior cerebellar peduncle. We are talking about all these because this nerve has to deal with your hearing and the equilibrium or balance of your body. Now, as being sensory in nature, so let's see how it is connected with your ear, the internal ear structure you are looking into. This is the cochlear shell, you would say, and this contains inside the organ of corti, carrying the hair cells as the receptors, bipolar neurons. From here, they have to pass through the spiral ganglia. Then they are making a nerve called the cochlear nerve, and you can see them being reached in the pons and medulla towards their respected nuclei. Now you can see there is another set of semicircular canals, then utricle saccule having the crista and the maculae as the hair cells, and they have to, these nerve rootlets, they are supposed to pass through vestibular ganglion and finally forming this process of central process of a nerve, the vestibular nerve, and they are also reaching their nuclear level, the vestibular nuclei. In this way, your equilibrium and hearing is maintained. We have to show you that these are also reaching to your cerebral cortex. For this, I will take you to another diagram. Now you can see them very well. In that, again, you can see the cochlea and the utricle and saccular semicircular canals regarding your internal ear. You can see the two sets of nerve which combinedly form two vestibulocochlear nerve. Inside this cut section, you can see they are making connection with the superior olivary nucleus and the trapezoid body, its posterior nucleus, and finally they are ascending upwards by passing through the lateral lemniscus of forming that you would say the track, and they have to reach the inferior colliculus of the midbrain and then to the medial geniculate body. Few fibers are also reaching over there. Then they will ascend in the auditory cortex of superior temporal gyrus. In this way, we are completing the course of the vestibulocochlear nerve and the details of its nuclei.